All right. Says we are live. Hello, everybody. Welcome. This is a Mama Tribe Network presentation, our After Dark series, Mama Tribe After Dark. When the kids are asleep and the mamas get to hang out, and we get to hang out with some awesome people today. I am super excited to have on again Dr. G. Let me just introduce that this is All Things Crunchy, if you didn't already know, and I'm MJ. But let me introduce my wonderful expert guest here, Dr. Philip Goscienski. Hi, Dr. G.
Hi, I'm MJ.
How are you tonight?
Doing great.
Good. Awesome. I'm so happy to have you back. I'm just trying to soak up as much information as I can from you. So I'm having you on my show a lot, as is Erin, OG Mamacita, and hope you don't mind.
I'd love to be here, the audience.
Good, good. Yeah, I know that, I mean, our viewers and the people that we are reaching, I know will benefit from the information that you have to present. And tonight we are going to talk about a lot of things, I know, in the whole realm of pregnancy and birth, and focusing on having a healthy pregnancy and a healthy birth. And so let me just say too that if you're watching us live, we have the Showcase app here on your screen. You should be able to bring it up. It has 3 yellow tags, and that you can click on that, and you'll be able to see Dr. G's website. It's stoneagedoc.com. He also has it here on his lower third, but it has tons of information. Dr. G, you have written an article like a week for a long time, and all these articles are. Say that again.
There are more than 500 articles
yes.
that are archived on that site.
That's awesome. And yeah, and everybody can just go there and they can look at the articles, read them, and get more information about the presentation topics that you do. So please visit Dr. G's website, and it's just a plethora of information. I'm like, I have to try to choose like what we're gonna pick as a topic, and it's just so hard because there's so many things that are just, you know, really well thought out topics that you know, your website is Stone Age Doc, and you know, so when you think of that, that's from a long time ago, but we're really, I think, in this time and age trying to get back to that, don't you think?
Yeah.
Yeah, I think that it's definitely, as far as our health and the benefits of you know, getting back to being healthy, we're getting back to our roots, thankfully. So, but without further ado, let's just get started. I know you have you know, points that you want to hit, and I know, you know, we've talked about these, so I know that you'll probably answer my questions, but if not, then I'll ask them. And if you are watching live, please, you have there's a Q&A that you can bring up, and you can ask a question. If you do that, or you have a comment, then I will try to bring it into the show for you. So, all right, Dr. G, I will let you take it away.
Great. Well, thank you, MJ. Well, you know, this whole issue of pregnancy is probably one of the keys to stopping the various epidemics that we're seeing now that are really beginning to affect the lifespan of everybody in the world. Mm-hmm. The epidemics that I particularly cite are obesity and type 2 diabetes, osteoporosis, which I call the third epidemic. Mm. Then there's dementia and Alzheimer's disease. And another one is kidney disease. And in a sense, these are all interrelated because they have some basic things that they share. And one of the most important is the matter of nutrition, and especially obesity. So let's address this issue of of nutrition during pregnancy. And there have been several studies that have shown that women of childbearing age are seriously lacking in a number of nutrients. And these are things like iron and calcium, magnesium, omega-3 fats, which I'll address in a little bit, and a number of others. And the numbers are really kind of astounding, because one study showed that only about 10% of women of childbearing age are getting the recommended amounts of these nutrients on a regular daily basis.
Oh, wow.
And when you look at what our metabolism was like 50,000 years ago, that was really not an issue. Yeah. Because we had the kinds of foods available to us all the time that would take care of all those needs, especially when it came to things like leafy green vegetables, which have many of the things that we need. When I think of leafy green vegetables, for instance, I think about folic acid. A number of years ago, a study was done on supplementing pregnant women with folic acid, because there was a rather high rate of babies being born with a spinal cord and brain defects. Mm-hmm. And what was discovered was that when women were supplemented with folate, the incidence of those defects dropped by about 50%. And a lot of pediatricians study was done, which showed the same thing. And a third study was done, which supported the previous studies. And now the government actually mandates that folic acid has to be added to baked goods, as an example, in order to get more folate into the diets of those population groups that just don't partake very much of green leafy vegetables. Yeah. And so that's an important issue. Yeah. Anyone who has been pregnant has probably gone to an obstetrician who has put them on a multivitamin, multimineral. And of course, these have two components that are often lacking in the diets of young women. One is iron, and the other is folate, which I just mentioned. Now, one of the reasons that's important is if we look at the overall picture of multivitamins, we find that in women whose vitamin intake is low, they have an increased risk of birth defects, especially defects of the heart and of the face, things like cleft palate and cleft lip. And although people who have a normal diet are said not to need vitamins, the sad truth is that almost no one has a normal diet. And there are a lot of reasons for that. And one of the reasons is that we depend so much on processed food and fast foods. We have gotten away from the kinds of things that your grandparents ate on a regular basis, which is largely whole grains, homegrown fruits and vegetables, and the kinds of things that we find in our supermarkets flatly don't have the kinds of nutrition that they had 100 years ago. Yeah. There are cultural schools that have done studies on the nutrient content of our farm produce, and there has been a steady decline in things like protein and B vitamins and iron and calcium and zinc. And we think we're getting all these things if we have an abundance of supermarket produce, but the fact is that we are not. And so this is one of the reasons why obstetricians add a multivitamin, multimineral, because it really does make a difference.
So if I can ask a question, or just, so basically you are really saying that even if somebody has or thinks that they have a super healthy diet and they consume lots of vegetables, lots of leafy greens, lots of fruit, meat, nuts, and they think that they've got a good diet, then those people would probably think that they don't need to have any sort of supplements. And what you're saying is that they probably should.
That's exactly right.
Okay.
If we look at the population as a whole, we find that only about 20% of Americans get the bare minimum of 5 servings of fruits and vegetables a day. That's not the optimum, that's the minimum. If we look at the optimum of 10 to 12 servings a day, it comes down to about 10%. And if we look at adolescents in general, the average adolescent in this country gets 0.9 servings of fruits and vegetables a day. And when we realize that that includes a lot of women of childbearing age, that means they're simply not getting the nutrition that they need.
Yeah.
It would be great to think that, well, I'm getting my 10 servings a day of fruits and vegetables. The fact is that if you were living back in the Stone Age, you would probably be eating about 3 to 4 pounds of plant foods every day.
Yeah. Yeah.
But something to keep in mind, and we'll be coming back to this, is that that's what our bodies are designed for. We evolved over a couple of million years to require that quantity of plant foods, and we're not getting it.
Yeah.
And the result of seeing diseases that simply did not occur even a couple of hundred years ago. Now, another issue when it comes to nutrition is calcium. Now, certainly, calcium is a concern to people in the middle age because they worry about osteoporosis. But in fact, osteoporosis occurs much earlier in life. And it's not just calcium. Now, calcium does make a difference. We do need a minimum amount of calcium every day. But it really is only about half as much as we are told to be taking by the some government agencies.
Okay.
As an example, a population who have calcium intake about 1/2 of what we take in, and they don't have osteoporosis. The reason for that is that they are very active, and exercise is an important factor in building strong bones. The challenge is that window of opportunity for building a strong skeleton exists between about kindergarten and about the mid-20s. So if a woman does not have adequate nutrition, and it's not just calcium, it's a number of other things, and does not have adequate exercise, and 80% of women of childbearing age do not get enough exercise, she enters pregnancy with a skeleton that doesn't have the bone mass it ought to, which means during pregnancy, when the fetus borrows some calcium from her skeleton, she is already losing more, and the fetus is not getting enough.
Yeah.
Especially true of women who, number one, don't get enough calcium, and number two, smoke. Because those two factors also contribute to osteoporosis. And if we look at the dietary habits of people in that age range, of childbearing age, we find that back in about 1970 or so, the average adolescent girl drank twice as much milk as soft drinks. In 2015, the average adolescent female drinks twice as much soft drinks as milk.
Yes.
And the price will be paid by their children who 40 or 50 years from now will be dealing with the problem of osteoporosis.
Right.
So we see how critical adequate nutrition is in order to prevent a major problem. One of the things that I often talk about is the osteoporosis cocktail. And the osteoporosis cocktail is more than just calcium, because there are several studies that show that if you only add calcium to your diet, it makes absolutely no difference in your risk of osteoporosis or fractures. That the osteoporosis cocktail involves things like vitamin A and the B complex and C, and especially vitamin D, magnesium, iodine, omega-3, and included in a well-rounded diet, which most people just don't get.
Yeah.
And so when we look at the issue of osteoporosis, especially as it relates to pregnancy, we have to remember that a pregnant woman especially should be concerned about getting a very adequate diet from all these components that I mentioned.
Yeah, definitely. Okay. That's awesome information. And I love the way that, you are giving us information that it's affecting us, but it's affecting our children too.
Absolutely.
Yeah. Okay. So then with the nutrition and the and pregnancy, I mean, is it almost let's see, how can I explain it? Like, is it pretty much assumed that once a woman is pregnant, that she's going to have certain deficiencies?
Well, most women in that age range, we're talking adolescents and the 20s and 30s, for instance, most women in that age range aren't getting everything they need to maintain normal pregnancy and another couple of years of lactation, for instance.
Gotcha. Okay. All right. So then I know that you touched a little bit on the omega-3s. Do you want to talk about that next?
Sure.
Or, okay.
One of my favorite topics, MJ.
Yeah.
One of the reasons that is one of my favorite topics is, first of all, I consider the lack of omega-3s in our diet the single most important nutritional lack in the country as a whole.
Yeah.
Across all age ranges. And omega-3 fats are important in every single cell of the body. Now, one of the functions of omega-3s is to improve immune function and also to decrease inflammation. No. If we look at some of the kinds of diseases we've been seeing over the last half century or so, they are largely related to inflammation. And the current theories of things like coronary artery disease, stroke, diabetes, osteoporosis diseases, is that they are all related to inflammation. And omega-3s lower inflammation, omega-6s, another kind of fat, increase inflammation. We get omega-3s especially from fish, which many people do not partake of at all.
Right.
And from some leafy green vegetables. There are omega-6s, primarily from vegetable oils. Now, when you think back a little bit, you realize that back in the Stone Age, there was no such thing as a vegetable oil.
Right.
People, and because there was no production of vegetable oils, there was a very small intake of omega-6s. The proper balance between omega-3s and omega-6s in a diet is 1-to-1. Most Americans now take about 50 to 20 times as much omega-6 fatty acids as omega-3 fatty acids.
Oh, wow.
That balance is largely responsible for the inflammatory diseases that we see, and especially for autoimmune diseases. And by autoimmune diseases, I mean things like multiple sclerosis, type 1 diabetes, to some degree type 2 diabetes, thyroiditis, rheumatoid arthritis, etc. And these are the kinds of things that were very infrequent a century ago.
Yeah.
These autoimmune diseases are largely due to the fact that we are not getting enough omega-3s and we are getting too many omega-6s.
Okay. Let me interrupt for just 1 second and we'll say hi to Oji Mamacita. Hi. The child is sleeping, so now
Child is sleeping.
the mama can play. Thanks for coming on, Mama. We're talking right now about omega-3s, and so I just to get you up to what we're chatting about. So, Dr. G, when you say omega-6s, I mean I know I've heard of this, but what do we find? Where do we find omega-6s in our food?
Most vegetable oils, things like safflower oil, sunflower oil, peanut oil, etc. Omega-3s come largely from fish oil, and canola oil. Now, all processed oils have a mixture of omega-3s, omega-6s, and omega-9s. Omega-9s are what we find in olive oil, and these are the monounsaturates, whereas the omega-3s and omega-6s are polyunsaturated fats. The omega-3s and omega-9s, like in olive oil, are good for us. The omega-6s are essential. We must have them in our diet, but we should not have them in the very high amounts that we do. One of the challenges, of course, is most people don't have omega-3s can usually be obtained from 3 or 4 servings a week of fatty fish, things like salmon, sardines, herring, tuna, albacore, etc. And oh, I see you, Aaron.
I know.
Most of them don't really care for fish very much, but there is no question that the people who have the highest intake of omega-3s, especially from fish,
it's just the really fishy that I don't care for, and that's where the good fat is, right? That's
right, unfortunately. But by having more omega-3s, you protect your body in a number of ways. One way is that omega-3s are important for osteoporosis that I mentioned. Mentioned for a good heart health. In the late 1950s, cardiologists began to study population groups around the planet, and they began to focus on the Inuit Eskimos of North America. But what they had observed was that those people, even though they might have some degree of heart disease, they almost never suffered from what's called sudden cardiac arrest. Now, sudden cardiac arrest is something that was very infrequent 100 years ago. But today, this very day, about 1,000 Americans are going to die of sudden cardiac arrest. 1,000 died yesterday. 1,000 will die tomorrow. The most common cause of that is a heart attack. And when a portion of the heart muscle is damaged because of lack of blood supply, because of blocked coronary arteries, for instance, when that muscle is damaged, it causes what amounts to a short circuit within the heart. And one of those rhythms is called ventricular fibrillation, which is one of those disorders that then leads to a standstill of the heart. And if a person has a high intake of omega-3s, then the nerve fibers within the heart muscle are protected so that that short circuit type of event does not occur. And they are less likely to undergo that abnormal heart rhythm, and therefore they can have a heart attack and not have a sudden cardiac arrest. And this is the advantage of Eskimos, who take on average about 13 grams of omega-3 fats a day through their diet. And the average American takes less than half a gram of omega-3s in their diet. And again, that high intake is what our bodies are programmed for, but we're not getting that because most people, let's face it, don't like fish. There's some people who literally never eat any form of fish. And we should be 3 or 4 servings a week.
4 servings a week. Okay, so now if I know that you probably should have like a wide variety, but I can definitely say that salmon and tuna is probably a weekly thing, but maybe not 4 times a week. And then salmon for us happens every now and then. We love it. We just don't, I think it's more kind of expensive. So, that's probably what deters us. But so if we are eating like tuna, like I said, probably once a week, but if we're eating like more of just one fish, is that not a good thing, or?
Sure. I'm a strong advocate of variety in everything. Variety in vegetables, fruits, everything.
Can't we get that fat from like nuts or something?
Pardon me?
Can't we get that fat from like nuts, walnuts maybe, or?
Yes, you can get some, but you would have to have an enormous calorie count from walnuts to give you enough omega-3. That's the challenge.
So I'll just take the pills then. Is that okay? Can I take
fish oil is okay, but you bring up an interesting point. There are a lot of products out there that, for instance, advertise they have 1,000 milligrams per capsule of fish oil. Mm-hmm. And we should be taking about 1,000 milligrams a day, not of just fish oil, but 2 components of fish oil, which are known as EPA and DHA. Those are the 2 omega-3s that matter for brain health, eye health, heart health, bone health. And if you read the labels on several of these, and I do this from time to time at vitamin stores or some of the big box stores, what I see is a 1,000 milligram capsule of fish oil has 150 milligrams of EPA and 150 milligrams of DHA. In other words, there's 700 milligrams of some other kind of fish oil, which may be good for us, but has not been studied. And the point is, if you're going to take fish oil, you should be getting a combination of EPA and DHA in the amount of about 1,000 milligrams a day. For people who have a personal or family history of heart disease, it should be double that, about 2,000 milligrams a day.
Really?
It's okay to get it from fish oil, but let's face it, there are a lot of advantages to getting it from fish. As an example, sardines. Now, you may not like sardines. A lot of people can't stand the taste and smell of sardines, but sardines are one of the best sources of fish oil out there because, in addition to the omega-3s, they come with calcium and protein. And there is no calcium or protein in a fish oil capsule. Right. So a better buy is a can of sardines. Now, salmon is okay. Salmon is a very good source of omega-3s, but keep some sources of salmon that is caught in the eastern things like PCBs, polychlorinated biphenyls, which are cancer-causing agents, and sometimes with mercury. So if you're going to have salmon, the best sources of salmon are wild-caught Alaska salmon. Yeah. Now, half the salmon that we have in this country is farmed salmon. And the question I get all the time is, how do I know that the farmed salmon that I'm getting is quality salmon? And the answer is, you don't. Just that can't tell. Yeah. And this is one of the reasons I tend to avoid farm salmon and prefer to get wild salmon. Sure, it costs a little more, but when you consider the cost of a heart attack or a stroke, that's a pretty good investment.
Yeah, totally. I agree. So I am one of those people that I actually, when I was pregnant and after, I took the fish oil just as like a spoonful. And so there's tons of fish oils out there. The one that I use is like a cod liver fish oil. I also, I don't know if this is true, but that it's supposed to be refrigerated. My sister told me that because she said it would go rancid out on the counter. So can you tell me about like cod liver fish oil and also if it's true that it needs to be refrigerated?
Oh, and can I jump in real quick and ask about the fermented cod liver oil?
Oh, yeah.
Also, the fermented cod liver oil and that butter mix thing. Yeah, okay, go.
Buttermilk.
Either of those products, so I can't comment on that. But let me make some comment about cod liver oil. One of the reasons cod liver oil became really popular in the early 20th century was because a lot of children were developing rickets from vitamin D deficiency. And when it was found that cod liver oil had a lot of natural vitamin D, rickets virtually disappeared from this country, especially when the government also mandated that vitamin D should be added to dairy products. And rickets, vitamin D associated rickets, almost disappeared from this country for about a century and is coming back now. The reason it's coming back now is a lot of today's children are not allowed to go outside. They are kept indoors. They don't get sun exposure, which means they're not producing vitamin D. And would you believe that we are seeing San Diego, one of the sunniest places on the planet? And so vitamin D is an important concept. And again, vitamin D is also present in a number of products, and eggs, for instance, have some vitamin D.
So it's actually maybe good then that I kind of refrain unless we're outside for a long time. I don't put sunscreen on my son for, just if we're just going outside, or even if we're out for a while. So
15, 20 minutes is no problem.
Okay.
Now, it's interesting you mentioned that little while. 15 or 20 minutes of exposure about 3 times a week with the face and the arms uncovered will give you all the vitamin D that you need. And 15 or 20 minutes of sun exposure without sunscreen will not increase the risk of skin cancer, which is what people worry about so much. But that amount of exposure is a nice balance. It's enough to give you vitamin D. It's not enough to produce skin cancer. And so these are important issues that people have to face. Now, there's something I want to get through before we get off that subject. Is the brain and the eye have very high concentrations of omega-3s. And we know that when omega-3 intake is deficient, brain quality is deficient and vision quality is deficient. And the babies that get the most omega-3s from their mothers during pregnancy and afterwards are the ones that have better levels of cognition and better vision, at least for the first couple of years of life. So omega-3s are really important for that issue. Now, one of the things that we have to also remember about omega-3s is that it also seems to be related to low birth weight. Mothers who have very low levels of omega-3s are more likely to deliver babies earlier and have babies of low birth weight.
Interesting.
Mothers who have low levels of omega-3s are also predisposed to postpartum depression. And postpartum depression is something that we see that can be actually correlated with low blood levels of omega-3 fats. Now, you may remember a number of years ago, it might be 10 years ago now, a woman, unfortunately, did in her, I guess, 3 or 4 children.
Oh, I remember this.
And she was apparently said to have done that because of postpartum depression. One of the things that happens in a woman who doesn't take enough omega-3s from natural sources especially or supplements, with each successive pregnancy, her omega-3 levels diminish. So by the time she has had 4 or 5 children, and that woman I think had 5, her omega-3 levels are very low, increasing the risk of postpartum depression, increasing the risk that the last baby's brain development and eye development will not be as good as the first baby's brain development. Now let me give you an illustration of how important nature thinks omega-3s are. During pregnancy, we see the greatest transfer across the placenta from the mother to the fetus of omega-3 fats. Well, what happens to the poor kid who was born 6 or 7 weeks early?
Yeah.
The nature says we are not going to shortchange you, because what happens is that the mother who delivers several weeks early undergoes a change in her breast milk so that her breast milk has more omega-3 fats than if she had carried that baby to term. And it tells you how important nature considers omega-3 fats.
That's awesome. Love it.
So is that the same kind of oil that you can get in like flaxseed? Or because I remember when I was pregnant, they were like, "Oh, make sure you take lots of flaxseed oil."
Well, here's the problem with flaxseed. Flaxseed has one of the precursors of omega-3 fats. The problem with flaxseed is the precursor has to go through a metabolic biochemical process, and you cannot make enough omega-3 fats from flaxseed to give you what you need.
Okay.
Because it's got that constricted biochemical pathway that does not allow that. Now, if that's the best you can do, and you won't eat fish, and you won't take fish oil, it's better than nothing.
Right.
I did take fish oil during pregnancy, so.
Pardon me?
I did take fish oil during pregnancy.
Good. I'm proud of you. Something about fish oil, that the capsules, but especially the liquid, give people what are called the fish burps.
Oh, yes. They were horrible.
Remember that? Okay.
Yes.
Here's how to get rid of the fish burps. Number one, keep your fish oil preparation in the refrigerator and take it cold.
Okay.
Number two, take fish oil with a meal and not separately. And number three, take your fish oil at bedtime.
Yep.
You will still get the fish burps, but it'll bother your bedmate and it won't bother you.
That's what I ended up doing, was taking them at night because I
Yep.
just couldn't handle it.
Yep. That's what I did too. That's actually what I do. I take fish oil every night. Awesome. Okay. Well, you answered my questions. What was that?
I'm sure that some people that are on this call might be concerned about mercury in fish.
Oh, yeah.
And that is a concern. And for that reason, pregnant women should not have more than one serving a week of something like tuna or albacore, because those fish, those large fish, are way up on the food chain, and they tend to concentrate toxins like mercury. So one serving a week, it turns out not to be a problem. And if a woman wanted to avoid those completely, I would be in tune with that. But again, the smaller fish, like salmon and sardines, etc., good amount, but they're not likely to have mercury levels that are of any consequence. Now, when it comes to mercury, mercury is a brain toxin. But for people my age, it is not a problem because my brain is fully developed. But for a growing fetus or for a child of 1 to 2 years old whose brain is rapidly enlarging and developing, it's more sensitive to mercury. And this is why it's recommended that mothers especially go out of their way to avoid mercury-containing fish, the large species of fish, during pregnancy, and their children should not get those kinds of fish either for the first couple of years of life. But once you reach the 20s or 30s, it's just not a big deal.
Okay. So everything in moderation, really, you know, when you're pregnant. And if you know, I remember my husband and I would go to a Friday night fish and chips, and I was saying, I don't want to do that if it's going to be bad. And it's like, you know, when do you do this? You know, you do this once a week, you do it, you know, if you did it every couple of weeks. So, you know, that was one of the things that was helpful was, you know, just everything in moderation, really.
Exactly. And with wide variety. Variety makes a difference.
Okay, I'm going to go get some herring from the store.
Okay.
And I'll call you up, Dr. G, and I'll have to have you help me because I won't know how to cook it.
Yeah, I have no idea. I mean, I had a really bad encounter with herring once in Europe, and I'm scarred. I'm scarred. But I don't know if I could ever bring myself to it. So.
Was it pickled or fresh?
I don't know. There was some slime around it, and it was apparently, supposedly, some great delicacy. And yeah, I noticed.
It screwed you.
I'm scarred. I'm scarred. Scarred. Yeah, there was a. I'll call it a perfume about it. It will never leave my mind. Sorry.
All right. So well, you answered my questions on that, Dr. G. Did we cover everything that you wanted to on omega-3s?
Yes. Yeah, we did.
Okay. Well, I'm interested in one of the next points. I don't know if you want to do talking about C-sections next.
Yeah. Well, C-sections are one of my favorite topics. And one of the reasons is that, first of all, we see many more C-sections around the world than are really indicated. The other thing is there's a reason why babies come through the birth canal.
Yeah.
That's not an accident.
Yeah.
If the birth canal was not a necessary part of the baby's existence, there'd be an opening in the front of the abdomen for the baby to just pop out.
Right.
Which, by the way, when I was about 6 years old, I thought that's how babies were born. But there are some things to consider. One is that the rate of C-sections in this country is over 30%. Yeah. Whereas if we go back to something like 1937, for instance, it was 3%. So we're doing 10 times as many C-sections now as we were doing 75 or 80 years ago.
Yeah.
Now, people haven't changed that much. Women's bodies haven't changed that much to prevent them from having a normal delivery. Now, granted, when an obstetrician makes a decision to do a C-section, I will never question that because there are very definitely valid indications for C-section.
Yeah.
But calendar is not one of them.
Yes.
Or an upcoming vacation are not reasons for a C-section. That comes to be a problem around the world. In China, for instance, the rate of C-section is about 52%.
Ooh.
In Brazil, hold on to your hat, in Brazil the C-section rate is 90%. That makes absolutely no sense from a medical point. And it's because of the lifestyle of people in those countries that demands that they have babies at the mom's convenience and the doctor's convenience, but it has nothing to do with the health of the child. Now, why is that a problem? We see that although C-section is a pretty safe procedure, the fact is that C-section babies are more likely to have breathing problems than babies born vaginally. Now, the reason is very specific. When a baby comes through the birth canal, that baby's chest is squeezed in that process. That squeezing of normal delivery squeezes excess fluid out of the lungs and makes the air sacs in the lungs fill up more easily with air, and therefore reduces the risk of either breathing problems or pneumonia, which we know are problems of C-section babies. Another issue is that a baby that is born outside the normal birth canal doesn't ingest the bacteria that are part of the normal flora that nature has demanded for a couple of million years.
Yeah.
And the baby bypasses that. And we know that it literally takes several months for C-section babies to acquire what should be their normal bacteria flora. Pardon?
I was going to say, and that's really something that can never really fully be recovered, right, or replaced. I mean, that's why they're looking at crazy things like the fecal implants now, as I understand.
Exactly. It takes a very long time. Some people who specialize in this area feel that a baby born by C-section never replaces the normal flora. I don't think we have to be that extreme. I think that it can eventually be replaced, but we know that it does take several months because birth is a very messy procedure, but that very messiness is natural and is what has evolved over the millennia. And that's where babies get a lot of the good bacteria that are necessary for building a normal immune system.
I heard. What was that?
So one of the reasons why babies who are born of C-section have a different form of immunity than babies born vaginally, because they don't have the normal flora which provide that.
Right. Okay. What I was going to say was, and I know, OG, you haven't eaten dinner, so go eat dinner and then come back. Well, what I've heard is that there are some doctors that are actually swabbing the vagina when they do a C-section to be able to get that swab and then be able to put the swab in the baby's mouth. I don't know, since you've been retired for a bit now, I don't know if you've known any, OBGYNs that do this, but seems to be something that everybody should be doing.
I agree. I think that even though it's something a very primitive way of doing things, it probably does have some benefit.
Yeah.
And let's face it, those babies do need what they swallow as they come out of the birth canal.
Yeah. Well, even just the way that you mentioned too, the squeezing of the rib cage, it just makes so much sense that, this is the way that we are set up to birth. This is the way that we're set up to be brought into this world, in a way that's as healthy as possible. And definitely medical interventions, like you said earlier, are so appreciated when needed. There's just so much overuse these days that it's affecting our health, and it's going to affect our children's health. It's just going to be a snowball effect.
Right. Another thing about the C-sections is that if a woman is given general anesthesia, then she cannot undergo the same kind of bonding with the infant that she could if she has a normal delivery, because the standard practice now of normal vaginal delivery is as soon as that baby is born, as they're in the process of even cutting the cord, the baby is immediately put on the mother's chest and is immediately put in contact with the breast. That's the way we are designed by nature. Yeah. And when you can't do that because of general anesthesia and a C-section, that's a problem. Right. And good to know that most C-sections don't require general anesthesia, but there are some situations in which that does occur. Yeah. Now, there's something that we have also observed as we're tracking infants who are born by way of C-section, is that they have a higher risk of getting asthma during childhood. Mm-hmm. There is a greater risk of type 1 diabetes, and they are more likely to be obese. Now, when it comes to type 1 diabetes and obesity, it may very well turn out, and this is what I suspect, that it's the acquisition of the normal gut flora that influences those conditions. And you have to remember that when it comes to probiotics and this normal gut flora, we are in the very, very earliest stages of understanding how that whole process works. And we're at the level that we probably will not know as much as we ought to for another 10 or 15 years. Okay. When we go back only 20 years, we used to think that there were only about 150 species of bacteria that populate our intestine. We now know there's about 1,000 different species that populate our intestine. And the challenge is that most of them cannot be grown in the laboratory like the ones we're familiar with. So we have come to rely on molecular technology and genetic technology to help us identify those bacteria, which we know are critical to normal growth and development.
Right. We've talked about this subject a few different times on a few different hangouts, and I know that I've heard you talk about it recently at the microbirth screening that we had here in San Diego. And we talked about the what you can do after having a C-section to help the not being able to be born vaginally and all the good things that can happen with that and in the gut flora. And as far as that goes with, breastfeeding and skin to skin and everything that you can do after the surgery. But is there anything that a woman can do if she knows she's going to have a C-section to kind of set herself up to have a successful, healthy birth and or maybe set herself up to I don't know, be an optimal health besides obviously diet and taking care of herself, exercise? And
well, probably the most important thing a woman can do is not to gain too much weight during pregnancy.
Okay.
Because there's no question that excessive weight gain is itself a risk factor in any kind of surgery, and that includes C-section. But this whole issue of excess weight gain is one of the things that we thought we'd talk about, and this might be a good segue into that.
Yeah, perfect. Let's do that.
Okay. Well, we know, first of all, that excess weight gain is a horrible challenge in this country. More than 70% of Americans are overweight.
Yeah.
More than 40% are obese. And those figures are occurring even in younger people. For instance, in 1970, about 4% of children between the age of about 3 and 15 years were obese. Now that level is 17%. In some localities like New York City, it is over 20%. And in certain communities like the Hispanic community, it is 27%. Now we're talking about rates of obesity in childhood that are 7 times as great as they were about a generation and a half ago.
Right.
And there is a high price to be paid for that. Now, when it comes to excess weight in mothers, something to keep in mind is, first of all, obese women deliver children who have a higher risk of birth defects, especially defects of the heart and the face. And those are certainly serious problems. And also, a woman who is overweight during pregnancy has more maternal complications. She is more likely to have a postpartum hemorrhage, which can be sometimes a fatal problem, more likely to have an infection, and more likely to have what's called deep vein thrombosis, blood clots forming in her legs, which can then travel to other parts of the body, especially the heart and lungs, which can cause serious problems as well. So simply being overweight or obese, especially obese during pregnancy, is a challenge. There's also the infant, the matter of gestational diabetes. Gestational diabetes, which we can also talk about in this section, has been increasing over the last couple of generations.
Yeah, what exactly is it?
Gestational diabetes is an abnormality of how the body handles blood sugar on a temporary basis during pregnancy. Now, one of the challenges is that it has been increasing and about doubling roughly every 10 years. So we're seeing a lot more gestational diabetes, which should not be any surprise, because we're seeing huge increases in type 2 diabetes, especially among the young adult and middle-aged population.
Right.
The rate of type 2 diabetes in this country now is at 9%. Of people over the age of 65, it is 30%. So it's still pretty high, even in younger people of childbearing age. Now, of women who have gestational diabetes during pregnancy, about half of them will develop frank type 2 diabetes within a 10-year period. So simply having gestational diabetes is a risk factor. And when you consider that type 2 diabetes almost always is because of obesity, you realize how important it is to manage weight before and after and during pregnancy.
Yeah,
Because
definitely.
the key factor, you don't see many people with type 2 diabetes who are slender.
Yeah.
There are some whose weight may be normal, but whose body fat percentage is not normal. And there is a medical category of that called normal weight obese. NWO is becoming a more familiar medical term. And we find that a very high percentage of women who appear to have normal weight for their height are in fact normal weight obese. So we're seeing complications of pregnancy like gestational diabetes that are increasing every few years.
Okay. Now, I don't know if you have an opinion or even maybe know the answer to this, but the testing that is done to find out if you have gestational diabetes, do you think that that testing is accurate? I remember doing, having to drink this like super sugary drink.
Postprandial.
Say that again?
A 2-hour glucose tolerance test.
Yes, yes.
Measure what's called postprandial. 2 hours later, they see if your sugar is in the normal range or not. And sometimes some places they'll measure every 30 minutes for 2 to 3 hours. They get a more accurate curve. And sometimes they'll measure insulin levels during that period as well to see if the insulin response is normal.
Yeah, because I know a lot of moms too. And, when I had my baby 4 years ago now, I just kind of, leaned on my midwife and asked her her opinion, but I ended up doing the test. But a lot of moms that I know try to get tested a different way than having to drink that drink. But do you feel like that is a pretty accurate test? Okay.
Yeah, it's pretty definitive. There are other things to do. One is you can take at 2 or 3 different times, 2 or 3 different days, because just one measurement is enough, fasting blood sugar. And if a fasting blood sugar is 125 or over, that indicates type 2 diabetes. And if it's only occurring during pregnancy, of course, that's gestational diabetes. Another is the HbA1c, hemoglobin A1c, which gives you an idea of what blood sugars have been like over the preceding several weeks. And both of those are relatively accurate. They sometimes have to be done more than once, especially if they're borderline. But keep in mind that one can usually avoid gestational diabetes by simply maintaining normal weight.
Right, right. Okay, awesome. Such good information, and just it all makes sense, really, when the way that I think in the order that we presented it too, there's things that can be done prior to, just even if you're not pregnant or, planning on having kids. I mean, being as healthy as possible is ideal. So
I think maybe the take-home message for today is something we actually didn't mention, and that is exercise is a critical factor. Exercise is important for a couple of reasons for a young woman. Number one, it helps to maintain normal weight. It also helps to maintain a normal immune system, and we still don't really know why exercise improves immunity, but we know that it does.
Yeah.
Critical factor is that women between the ages of 5 and 25 must exercise on a regular basis to maintain normal bone mass. Because if a woman gets to the age of 30 with a bone mass that is maybe about 5% or so less than what it should be, she faces osteoporosis when she's in her 50s and 60s. And it's a real concern about people who are studying this field that in a few more years, we are going to see a massive epidemic of osteoporosis and hip fractures in women in their 50s and 60s, because once you miss that window of opportunity between 5 and 25, it's very difficult to increase your bone mass at that point. It's possible, but you never really have the same opportunity that occurs during those years.
Yeah, and in those years, about half of those years, you don't really have control over what you're eating. It's, you know, your parents that are presenting the healthy options. So, you know, this is almost even a, you know, a good thing to tell parents who, I mean, thankfully, we educated ourselves on how to introduce foods to my son, so he has a great palate. And you know, we'll often get the comment of like, how do you get him to eat that? And it's like, we give it to him. We say, this is what we're eating.
It's either that or nothing, right?
Yeah, and actually try it and see if you like it. That's the one that we've been using lately, and it's like, oh, I actually like it. So, you know, I mean, that's one of the things that I'm hearing you say a lot is that, you know, we're the way that we're setting ourselves up for the future and for the rest of our lives is in the beginning. And, you know, it makes total sense, but, you know, even more so if, you know, whoever is watching this, parents or not, especially if you're parents, you know, this is another really good reason to present healthy options for your children, because this is, you know, creating the body that they're going to have to live with the rest of their lives.
Right. And there's no going back. Once it's done, it's done.
Yep. Yep. Very cool. Well, I always learn so much hanging out with you, Dr. G. We covered a lot. Did we miss anything?
Nope, I looked over my notes and we covered everything that I wanted to talk about.
Yeah, awesome. I looked over mine too. And I mean, there's, you know, I tried to not go off on too many tangents, but you answered all my questions, so I really didn't have to to talk too much. But I'm going to have you on in a month. We're doing this kind of a monthly thing with our Mama Tribe After Dark series. Erin and I are alternating Fridays, so she'll have the next Friday, and then I'll have the Friday after that. But I am having you on pretty much once a month, and I'm so excited. Thank you so much again for wanting to do this with us. And you know, not really decided what the next topic will be. So if you're watching this video, please leave us a comment. Let us know. Take a look at Dr. G's website, thestoneagedoc.com. I have it up here. He's got it on his lower third, and check it out. Look at what his presentation topics are, or any of the 500 articles that he has there, and let us know.
Something worth talking about in 500 articles.
Something. Well, even just your presentation topics, I love just the title. You know, the titles say a lot about, because they're obviously, every single thing, even that we talked about tonight, probably could be its own episode with, you know, the amount of information that you could cover. And so, you know, that's probably why you have so many. So, all right, Dr. G, well, hang out with me for a second. I'll stop the broadcast here, and then we'll chat in the green room. But thank you, everybody, for being with us tonight. And if you're watching it afterwards, thank you very much. And you can definitely reach me at allthingscrunchy@gmail.com, or my Facebook page, allthingscrunchy.com, or on YouTube. I'm under my name, MJ Fisher. So subscribe to my YouTube channel so you keep getting my videos. And reach out if there's any topics that you're interested in us covering. So I'll see you in a couple weeks, but I'll see you next week on Erin's Hangout if you guys hang out with us again. So thank you so much, Dr. G.
You're welcome.
All right. Good night, everybody.